Chapter 67, The Interaction of the Mind and Body, examines the links between the body and mind and their effects on health. A person's body and mind are dynamically interrelated, so it follows that the stress felt in one area of well-being can have effects in other areas. I'll give you a few examples. An athlete who is injured and unable to participate in the sport may experience significant emotional distress as a result of the physical injury and the long recovery. Someone who is going through a difficult time emotionally may experience physical symptoms such as stomach aches. An individual who is struggling with academics or professional work may have trouble sleeping, feel depleted, and suffer both emotional and physical. Although the understanding that emotions affect physical health dates as far back as the 2nd century through the writings of the physician Galen and the medieval physician and philosopher Moses Maimonides, modern medicine has largely continued to treat the mind and body as two separate entities. In the past 30 years, however, the research into the link between health and emotions, behavior, social and economic status, and personality has moved both research and treatment from the fringe of biomedical science into the mainstream. According to the mind-body or psychosocial paradigm, which supersedes the older biomedical model, there is no real division between mind and body because of networks of communication that exist between the brain and neurological, endocrine, and immune systems. An increased number of U.S. medical schools now have departments devoted to mind-body research and some also to mind-body treatment, including Harvard University, Columbia University, University of California, Los Angeles, and the University of Pittsburgh. This now interdisciplinary research field, which also includes behavioral medicine, is often called psychoneuroimmunology or psychoendoneuroimmunology and incorporates the ideas, the belief systems, hopes and desires, as well as biochemistry, physiology, and anatomy. Several factors have driven this steady growth, and most prominent is patients' increased interest in self-care, wellness, and alternative medicine, and their concomitant dissatisfaction with the success of allopathic medicine in preventing and treating chronic illnesses. First, take a moment and stop this presentation in order to review the learning objectives for Chapter 67. Your mind and body are, in fact, powerful allies. How you think can affect how you feel, and how you feel can affect your thinking. An example of this mind-body connection is how your body responds to stress. Constant worry and stress over jobs, finances, or any other problems can cause tense muscles, and pains and headaches and stomach problems. It may also lead to high blood pressure or other serious problems. On the other hand, constant pain or a health problem like heart disease can affect your emotions. You may become depressed, anxious, and stressed, all affecting how well you treat, manage, or cope with your illness. But your mind can have a positive effect on your health too. Having a positive outlook on life might help you better handle pain or stress and stay healthier than someone who is less hopeful. As you learn in anatomy and physiology, the brain is a complex organ made up of the cerebrum, the brainstem, and cerebellum. The cerebrum is the brain's largest component. It is the basis for the sensory perception, voluntary movement, personality, intelligence, language, thoughts, judgment, emotions, memory, creativity, and motivation. The outer layer of the cerebrum receives, processes, integrates, and relays information to appropriate functional areas of the brain. So the cerebral cortex is the major pathway of physiologic intercommunication. Question number 1. Is the following statement true or false? The cerebral cortex is the pathway for physiologic intercommunication. The statement is true. The cerebral cortex is the pathway for physiologic intercommunication and is part of the cerebrum, the brain's largest component. The limbic system is a network in the brain that contains structures involved in emotions and related physiologic functions. It includes the thalamus, which connects many brain centers and modulates movement, sensation, behaviors, and emotions. The limbic system also includes the hypothalamus, which controls the autonomic nervous system and coordinates the endocrine and immune systems through pituitary adrenocortical connections. Because of its neuroendocrine and neuroimmunologic roles, the limbic system affects and determines many psychobiologic activities. The receptors are structures found on the surface of cells throughout the body and as well at the level of the brain. Each cell has millions of different receptors. The receptors are able to sense and pick up chemical messengers that arrive in the extracellular fluid. A chemical messenger may be thought of as a very specific key that fits into and binds with a specific receptor. Only those messengers that have molecules in exactly the right shape can bind with specific receptors. For example, opioid receptors can bind only with chemicals in the opioid group, such as heroin or morphine or endorphins. Once binding occurs, a message is received, and the cell begins to respond to that. Chemical messengers may be natural or synthetic, and the message may cause the cell to perform any number of activities. Neurotransmitters are the chemical messengers that play a significant role in regulating all physical, emotional, and mental processes. Neurotransmitters are natural endogenous chemical messengers that communicate information that affects thinking, behavior, and bodily functions. The chemicals, which are synthesized in the neurons and then stored in vesicles in the axons, are released and attach themselves. They bind themselves for only a limited time to the receptors on the postsynaptic neurons. Once the chemicals have transmitted their information, they are either broken down into inactive substances by enzymes such as monoamine oxidase, acetylcholinesterase, and there are others in the same category. They can be recaptured by the releasing neuron for later use, a process called reuptake, or they can be weakened by becoming diluted in the intercellular fluid. Neurons will be classified by the type of the neurotransmitter that they release. For example, we'll have cholinergic neurons that release acetylcholine, and we have dopaminergic neurons that will release dopamine. Question number 2. Is the following statement true or false? After delivering their chemical message, neurotransmitters are inactivated. The statement is false. Neurotransmitters have 3 potential uses after transmitting their message: being broken down into inactive substances, being recaptured for later use, or they may become diluted in intracellular fluid. Neuropeptides are a separate type of neurotransmitters that include endogenous chemicals such as substance P, which transmits the sensation of pain, P coming from pain, endorphins and enkephalins that are morphine-like neuropeptides that interrupt the transmission of substance P and by doing that promote a feeling of well-being, and neurohormones that are released by interactions between the hypothalamus, pituitary, and the endocrine glands they stimulate. Each of those neurotransmitters has either a stimulating or an inhibiting effect on neurons. All brain functions, including thoughts, emotions, or messages to organs and muscles, depends on neurotransmitters. Receptors for neurotransmitters and neuropeptides are located not only through the central nervous system, but also in the endocrine and immune system. This findings suggest that all the systems, in fact, communicate with each other through chemical messages. And this concept has tremendous implications for how the mind and emotion can affect physical well-being and how physical status can affect back the mind. Please take a moment and stop this presentation in order to review this table, in which you will find some selected neurotransmitters with their names, the way that we abbreviate their names, and examples of their functions. Mental health is wildly misunderstood, and there is a stigma that surrounds mental health issues. That this stigma prevents people from, in fact, getting the help they need. The only way to stop the stigma is to learn as much as you can about it. The best way to do that is to dispel some of the common myths about mental illness. Historically, many believe that mental illness resulted from character defects, demonic possessions, or punishment by God. Currently, this myth have been replaced with new misconceptions such as having a mental health issue means you're crazy, mental health issues are rare, or mental issues are a result of bad parenting, or people with mental issues are violent, or in some cases, different races are more prone to mental illness. The study of brain structure, chemistry, and genetics has begun to replace ignorance and misinformation about mental illness with facts. Brain pathology is now seen as the major factor contributing to mental illness and now is called psychobiologic disorder. And some examples of the psychobiologic disorders are stress-related or anxiety disorders, mood disorders, eating disorders, chemical dependence, and thought disorders. The neurotransmitters, um, dopamine, norepinephrine, epinephrine, serotonin, and acetylcholine, are often implicated in the psychobiology of mental illness. Because the neurotransmitters are concentrated in different areas of the brain, the disruption of a neurotransmitter system results in a very specific symptom associated with that area of the brain. And I'll give an example. Dopamine influences movement, memory, thoughts, and judgment. The disorganized thought patterns and bizarre behavior of schizophrenia have been correlated with an excess level of dopamine. The impaired balance and uncontrolled tremors of Parkinson's disease have been linked with low levels of dopamine, on the other hand. Serotonin, another type of neurotransmitters, is found in areas that regulate sleep, appetite, sexual behavior, and mood. Imbalances in serotonin are thought to be responsible for depression, eating disorders, sleep disturbances, and obsessive compulsive disorders. Now let's look into what happens with an excessive level of the neuroexcitatory neurotransmitter that is called glutamate. This one have been implicated in the neurodegenerative disease such as amyotrophic lateral sclerosis, Huntington disease, multiple sclerosis, and the cerebral ischemia sequelae after a stroke. Question number 3. Is the following statement true or false? An abnormal amount of dopamine released in the brain can cause illness. The statement is true. An abnormal amount of dopamine released in the brain can cause illness. Excessive dopamine release can result in disorganized through thought patterns, as in schizophrenia, while a deficit of dopamine that is seen in Parkinson's disease will create the typical Parkinsonian symptoms. Other insights into brain physiology have come from observing the effects of medication on behavior and symptoms, which is called psychopharmacology. The theory that depression results from decreased levels of norepinephrine and serotonin was first suggested when the monoamine oxidase inhibitors, which block the inactivation of norepinephrine and serotonin, were found to alleviate depression. Similarly, anti-anxiety medications, such as the benzodiazepines, will activate the gamma-aminobutyric acid receptors that will, as a result of that, will inhibit arousal, inhibit excitement, and aggression. Riluzole or Rilutec is an anti-glutamate drug that has shown therapeutic benefits for the treatment of amyotrophic lateral sclerosis that is a condition that is also known as Lou Gehrig disease. Psychological factors, which are forces that can shape behavior if we need to define them, will also influence psychological equilibrium, and this may be tied to brain chemistry as well. Some researchers propose that the neurotransmitter network links emotion, memory, and learned behavior. Psychological factors have long been components of psychiatric theory and include intrapersonal development, interpersonal interactions, and learning. Sigmund Freud proposed that disordered behavior is the result of intrapersonal, within oneself, conflicts that arise during particular stages of development between infancy and adolescence. For example, Freud correlated compulsive neatness and stinginess with a rigid toilet training. Freud greatly emphasized sexual aspects of behaviors between an infant and mother, conflicts surrounding toilet training, awareness of gender differences and genital pleasure, rivalry with the same-sex parent, investment of energy in intellectual pursuit, and efforts to establish relationships with members of the opposite sex. Although many of Freud's theories have been questioned and negated, they were rejected, revised, and expanded. He provided, in fact, the foundation for the current fields of psychiatry and psychology, and by doing that, many of his tenets have withstood the test of time. Other theorists, such as Erik Erikson and Harry Stack Sullivan, propose that mental health or illness is a consequence of social relationships and interpersonal interactions. There were others that will go even further than that, suggesting that a person's mental stability not only is affected by relationship with significant others, but also is influenced by a social system, such as the neighborhood they live in, the city they live in, and even the country where the person resides. The more positive the social system, the better will be the chances for that person to have mental health and become well adjusted. The psychologist B.F. Skinner proposed the theory that adaptive, and as opposed to that, the maladaptive behaviors are actually learned and repeated because of rewarding reinforcement. This theoretical perspective is applied in various circumstances, such as when young children are offered candy to induce toilet training, or when privileges are withdrawn to extinguish some unacceptable behavior. Some will propose that hypochondriasis, which is an abnormal fixation about the status of one's health, develops because a person receives excessive attention and concern from others during childhood illnesses, which were unconsciously perceived as a rewarding fact. Brain dysfunctions can cause a combination, a mix of psychobiologic signs and symptoms. The American Psychiatric Association defines and establishes symptomatic criteria for very specific mental disorders within the psychiatric illness domain in what is called the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, or the DSM-5. For example, disorders including those involving anxiety, mood changes, abnormal eating patterns, chemical dependence, thought disturbances, and others can be found in this book, and they are very well defined and described. Ultimately, the client's signs and symptoms affect the relationships they have with others and will interfere with the age-related role responsibilities that person needs to carry out. Beside the comprehensive personal and family medical history, clients need to undergo a mental status examination, psychological testing, and laboratory and diagnostic testing. Please take a moment and stop this presentation to take a look, examine, and reflect on this image that is a copy of the mini mental state examination. And please note the similarities between the first two groups and how is actually, in fact, kind of a head-to-toe assessment of orientation. If you look into that, the patient will be examined in following areas: temporal orientation, spatial orientation, registration, attention and calculation, remote memory, immediate memory, a repetition of a sentence, a stage command, writing of a complete sentence, reading and obedience, and how are they able to copy a diagram. The psychological tests are administered to detect personality characteristics or to determine interpersonal conflicts or to determine the self-concept. Many of those are listed in your textbook. However, there are several others not named here. Measuring levels of neurotransmitters or neuropeptides can be difficult and may be expensive and sometimes even impossible to perform. Unfortunately, because of that, the definitive diagnosis for many psychobiologic disorder is usually achieved by ruling out other diseases that manifest in very similar ways. One of the newest diagnostic tools we have is called the brain mapping. And in a way, we think that the future diagnosis of psychobiologic disorders will be done in a more efficient way. The brain mapping represents a technique that compares the client's brain activity patterns that is registered from an EEG or any other electronic image with a computerized database of electrophysiologic abnormalities. There is in fact, a growing database of distinctive patterns for seizure disorders or schizophrenia, depression, dementia, anxiety disorders, or attention deficit and hyperactivity disorders, autism, and others that we have nowadays, and we are able to compare them with those of our patients. The treatment of psychobiologic disorders depends on the specific diagnosis, and there are a few modalities of treatment, including drug therapy, psychotherapy, cognitive therapy, and behavior modification. Looking at those, the drug therapy will look into aim for correcting the underlying biochemical abnormality and is particularly useful for mood disorders, anxiety disorders, and schizophrenia. The goal of psychotherapy, the cognitive therapy, and behavior modification will aim to uncover repressed thoughts and emotions and identify healthier coping mechanisms. The nurses will play an active role in all aspects of the treatment, including and starting with administering and monitoring response to drug therapy, implementing behavior modification plans, and providing individual and group counseling when needed. In addition to the study of the biologic basis of mental illness, brain chemistry and its effects on physical health are being widely researched as well. Emotions, which originate in brain structures and chemicals, can powerfully influence an individual's health and sense of well-being. According to Selye's theory from mid-50s, the stress is a psychological response to biologic stressors, such as, let's say, surgical trauma or infection, psychological stressors such as worry and fear, or sociologic stressors including a new job or increased family responsibilities. Stress has been implicated in the development or exacerbation of autoimmune diseases, anorexia nervosa, obsessive compulsive disorders, panic attacks, thyroid conditions, heart disease, functional and inflammatory disorders of the gastrointestinal tract, chronic pain conditions, and diabetes. Stress in fact, is not an entirely negative concept. Just the right amount of stress, called eustress, eu meaning normal, is what in fact will maintain a healthy balance in life. By being exposed to eustress, an individual is able to pursue goals, to learn how to solve problems, or manage life's predictable as well as unpredictable crises. This stress, excessive or ill-timed or unrelieved stress, will trigger the general adaptation syndrome, which is a very non-specific physiologic response to a stressor. This response, which can cycle many times through the alarm and resistance stages before reaching the exhaustion stage, occurs through the neuroendocrine and the autonomic nervous system. The most common pathway for the stress response is through the neuroendocrine processes involving the sympathetic division, the flight or fight system, which uses norepinephrine to stimulate body system arousal and anxiety in response to, again, a stress that may produce this type of fight or flight response. This response overrides the control of the parasympathetic nervous system, which most of the time function during our normal stages when the parasympathetic nervous system will maintain just the metabolic processes. A few individuals respond to stressor through the parasympathetic pathway. Instead of being stimulated to fight or flight, the parasympathetic responders will exhibit a freeze response, and they become frozen by the fear. Just as the body responds to stressors, the psyche, or the mind, also reacts to the stress. And coping mechanisms are unconscious tactics the humans use to protect themselves from feeling inadequate or threatened. These mechanisms function like psychological first aid by helping us temporarily to avoid the emotional effects of a stressful situation. When used appropriately and in moderation, the coping mechanisms will allow to maintain the psychological equilibrium and lead to psychological growth. When a person overuses coping mechanisms, however, he or she will become dysfunctional. In addition, some individuals develop maladaptive coping mechanisms such as abusive alcohol or other substances. Hardiness is a particularly effective coping style, and characteristic of hardiness will be some of the following. It should be a commitment to something meaningful versus a sense of alienation, or having a sense of control over sources of stress versus a feeling of helplessness. Or another one would be the perception of life events as a challenge rather than a threat. More recently, there are a few other authors, including Southwick, that describe positive responses to stress among those possessing resilience. Let's see how the American Psychological Association is defining resilience. They say that the resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats, or even significant sources of stress. Characteristics such as accepting help and support from others, looking beyond the present to the future, and keeping things in the perspective while maintaining an optimistic outlook, all of them are strategies that promote resilience. Those are a few elements that we will look into when talking and describing coping with stress. We have emotion-focused coping skills, or we can have what is called a problem-focused coping skills. We look into exploring the coping strategies. What will be the positive ones as opposed to the negative ones? We'll set priorities in terms of what things need to be done right now as opposed to those elements that can be postponed. We'll suggest cultivating relationships. We'll teach the client assertiveness as opposed to being a passive having a passive way of dealing with the situation. We'll discuss time management, that this is essential. We'll recommend exercise, which is a very good way of relieving stress, and we'll always recommend to avoid alcohol. Let's explore for a moment a few effective coping skills and how can we foster this behavior. And those elements that are described in this slide are taken from the table that is in your textbook. Let's look at this for a moment. You can see that we will try and explore coping strategies with our patient. And we'll do that by asking them what helped them in the past. And if that applied to the current situation, we'll encourage them to use them again. We'll encourage them, the clients, to be able to define their priorities and to have a healthy balance between work and play, between work and rest. Again, we'll suggest cultivating relationships with the family and friends, and this because every single one of us needs support. We'll need to teach our clients and practice with them how to experience assertiveness skills in terms of stating clearly their feelings and how to say no to unreasonable requests. Regarding time management, which is essential, we'll emphasize the importance of getting up early, avoiding procrastination, performing the stressful tasks when they have the maximum energy at the beginning of the day and not leave them at the end of the day, that being a mechanism of trying and avoiding those stressful tasks. Elimination or delegating unwanted tasks whenever is possible. Again, we'll go and we'll recommend daily exercise in order to reduce the stimulating neurotransmitters by burning out all that energy. And through exercise, we release endorphins and enkephalins, and those produce a state of well-being. We'll also recommend them to try and increase by 5 minutes each day the amount of time that they spend exercising, up to a point that they are able to do a 30 to 40 minutes period of physical exercise every day. We'll always recommend to avoid using alcohol or any other OTC or non-prescribed sedative drugs in order to self-treat themselves. We can suggest to start writing about their feelings, to keep a diary in order to get to a point where they are able to verbalize any traumatic or angry thoughts. We also can recommend stress management education and joining a support group regarding what type of stress management type of group is that. It's always beneficial. We are looking now into the biological factors, and support for a biologic connection between the mind and the immune system is found in research, and it demonstrates that the immune system and the brain communicate by using the same chemical messenger system, by using neurotransmitters and immunopeptides. Now, immunopeptides or immunotransmitters are called cytokines, and they function actually in the same way as the neurotransmitters. They relay messages through the immune system and the brain. Immune cells can also secrete small quantities of neurochemicals. In addition, nerve cells connecting the organs of the immune system, as the thymus, spleen, and all the lymph nodes to the brain, we have those systems that we are able to identify biologically now. This ability to communicate through chemicals implies that the immune system can make the brain aware of processes of distant sites in the body. And on the other hand, that the brain can send messages directing the immune system's actions. The powerful actions of neurotransmitters, and especially in the states of excess or depletion, the extreme states of quantities of neurotransmitters, suggest that the psychological state can significantly affect the immune system. We'll define now two terms. One will be the psych, and psych refers to the mind, while soma refers to the body. The term psychosomatic means pertaining to the mind-body relationship, while psychosomatic illness refers to illnesses influenced by the mind. In the past, psychosomatic had a negative connotation, suggesting that the client's illness was not really medically legitimate. Psychoneuroimmunologic research, since that started in the early 80s, however, is able to give this term a more holistic meaning and will actually reflect the concept that the mind and the body are not separate. Psychosomatic disorders, also known as stress disorders, are bona fide medical conditions and they are associated with or aggravated by stress. Many healthcare providers now believe that all illnesses, if not psychosomatic in origin, they may have psychosomatic components. In addition to the known effect of stress on the autonomic nervous system, studies have shown that stressful events such as, let's say, preparing for an examination or undergoing employment issues may affect the immune system. The purpose of the immune system is to defend the body against cancer or any kind of invading pathogens. Stress can lower the number of the white blood cells, the immune system fighters. And the research also shows that chronic stress or very intense stress, such as death of a spouse, has a greater effect on health than temporary stressors. And this finding seems to be particularly true when a person lacks supportive relationships. A connection seems to exist between poor immune function and loneliness. When individuals share emotions with others, their immune function improves. Many stress-related diseases involve allergic, inflammatory, or altered immune responses, and they are characterized by physical symptoms that will cycle through periods of remissions or absence of symptoms and exacerbations, recurrence of symptoms, with the symptomatic episodes often occurring when the client is under stress. The brain-immune system connection suggests that changes in body chemistry during periods of stress will trigger an autoimmune or a self-attacking response or result in immunosuppression. The association of certain psychological characteristics with an increased incidence of illness has been observed for centuries, in fact, and research suggests that there may be a generic disease-prone personality with character traits that include anger, hostility, depression, anxieties, and the type of disease that develops is actually related to an individual health habit, to an environmental exposure, a family history, and some other socioeconomic factors. So we know that anger can be a normal emotion. However, some people fail to express it, and perhaps feeling threatened by possible retaliation is the cause for that, for them not expressing it. This type of people will spend a vast amount of energy maintaining a facade of being happy and well adjusted. The effect of chronically suppressing anger and the neurochemical changes that will follow with that may trigger mechanisms for a dysfunctional immune response. As opposed to that, we have evidence that suggests that the axis expression of hostility and anger is correlated with an increased incidence of heart attacks and may result from low levels of serotonin. The frequent activation of sympathetic nervous system in persons prone to anger and hostility is another factor implicated in the development of heart disease. Some other theories will propose that unmet dependency, um, needs and fears of rejection or abandonment provoke feelings of insecurity among some individuals that exhibit psychosomatic disorders. Helplessness is related to dependence, and there are enough studies that show that people who feel powerless in their lives have more illnesses than those that have a sense of control. Ambivalence means feeling or acting in two opposite ways at the same time. For example, you may feel hostility toward the person from whom you actually want to love and get approval from. Or a client may act independently and yet desire dependence. All those unresolved conflicts may affect neurotransmitters and immune functioning and may be another key to the development of physical disorders. Many stress-prone individuals seek medical attention when they experience symptoms in one or more organs affected by the autonomic nervous system. So the clients may present with heart palpitation and headaches, restlessness, tightness in the chest, chest pain, chronic pain, irritability, any type of abdominal pain, including epigastric pain, abdominal discomfort and bloating, or constipation that may alternate with diarrhea, and many other illnesses, including cancer and cardiovascular disease, which are not obviously related to stress, but are thought to have psychosomatic components. The biopsychosocial effects of stress and mental state should be considered whenever we evaluate and treat any illness. Diagnostic tests are done to determine the extent of the disease and all physical causes for the client's symptoms. And we do that because there are other conditions, for an example, excessive intake of caffeine, cocaine use, a mitral valve prolapse, hyperthyroidism, hypoglycemia, or lactose intolerance, just to refer to the previous signs and symptoms that I presented that can mimic the signs and symptoms of some stress-related diseases. So that's why it's important to conduct the test before assuming that the disorder is typically stress-induced, and we need to prove that it doesn't have a biological base. The treatment involves standard medical care pertinent to the diagnosis, control the physical symptoms, and implement methods that are effective in managing stress and supporting the immune system. Nurses have an important role in participating in the treatment and education of the clients regarding all those methods. Stress management and other techniques have gained acceptance based on studies that they do show that psychological factors can reduce the effects of the stressors on the immune system and will facilitate healing. Stress management programs will provide the client with information regarding relaxation techniques, and sometimes may be very useful to send them for learning effective coping strategies. And among those coping strategies, we need to include assertiveness and developing a network of social support. Psychobiologic intervention refers to those techniques that use the mind and body to alter a disease. And some examples of the mind-body connection that I was giving you before, as they relate to integrative therapies, a combination of conventional medical treatment with non-traditional physical and non-physical approaches. The placebo effect is often used as an example of how the mind and body are actually connected. Just to describe it for a little bit, a placebo is an inert or inactive substance that by its very nature cannot produce any alteration in our physiology, yet does so in a significant number of people. The placebo effect refers to the healing or improvement that takes place simply because the individual believes in a treatment method to be effective. The placebo effect was first observed during drug research. In most clinical drug trials, half the research volunteers will receive the drug being studied, whereas the other half will receive a placebo. None of the volunteers or the researchers will know which subject is receiving the actual drug, and this process is referred as a double-blind study. At the end of the study, when the results of the study are analyzed, the researcher typically find that 30% or more of the individuals who received the placebo experience improvement. And that is thought to show how a person's belief system can positively influence health, and that a purely psychological basis for recovery exists. In other words, when your client believes in the treatment regimen and have faith in the prescriber, it potentiates a positive outcome. Harnessing the psychological forces that create a placebo effect by communicating care, optimism about treatment, and the belief that the client has the ability to recover can, in fact, significantly affect the wellness of your patients.